Welcome to my channel once again. Today we are going to look at some medical terminologies under the digestive system for nursing examination. Alright, so let's begin with the bleeding and stool abnormalities, the terminologies under this sub heading. Alright, so our first one is hematemesis or hematemesis. Emesis is related to vomiting and heme is blood, so this is simply vomiting blood. Key thing you need to know about this terminology is that fresh blood appears bright red, but the digested ones looks coffee grounds due to stomach acid. So technically, hematemesis doesn't mean you should actually see a bright colored vomitus, which is red, to be signified or termed as hematemesis, but it can come out as a coffee ground due to stomach acid. So we have melena or melena stool, which is a black tarry foul smelling stool containing digested blood. So this is as a result of what bleeding coming from the upper GIT, right? So meaning it has undergo all the necessary process of digestion. So it's more common in peptic ulcer. So it appears black and tarry and has a very foul odor. Let's look at the third, which is hematochezia, which is closely related to the melena stool. But this is passage of fresh, bright red blood per rectum. So this can be either with stool or not. With stool or not. So the stool can be there covered with fresh, bright red color, which is the blood, or solely blood has been eliminated via the rectum. And this is usually points out to what the lower GI bleeding. Example in hemorrhoid and diverticulitis. Technically meaning that the bleeding is just within the rectum. So technically it doesn't go through all the needed digesting processes which alters its color to black or tarry. Right. Our fourth terminology under this subheading is thoria. So these have to be a fatty, greasy or fruited stool that often floats and then has a foul odor as well. So this indicates a fat malabsorption, rather a fat malabsorption, often seen in chronic pancreatitis or celiac disease. So these are the results of failure of fat absorption. Sometimes maybe in liver conditions where bile is not secreted enough, or maybe look at the gallbladder as well. Conditions of the gallbladder and the liver can also be a factor, because here bile is not produced enough to emulsify the fat, so it comes out as a fatty greasy stool. So let's further continue with the subheading digestion and intake problems under these medical terminologies. So we have dysphagia, which is difficulty in swallowing. Most people normally confuse this with odynophagia, yeah, because of pain. Because sometimes the pain actually affects swallowing, making swallowing difficult. But technically, dysphagia is difficulty in swallowing. Then dyspepsia is just a general term for indigestion or stomach upset. Then we have odynophagia, as I said earlier, that is pain when swallowing. We have pyrosis, technically known as heartburns. Yes, heartburns, and it's a burning sensation in the chest caused by acid reflux. Then here we have tenesmus, which is a distressing continuous urge to evacuate bowels even when they are empty. So normally this is a cardinal sign you see in dysentery, especially amoebic dysentery.